ConMed Endoscopic Technologies reaches for the greater potential in clinical endoscopy by providing solutions that address real clinical challenges. One solution, the ConMed EnTake enteral feeding device, was designed for gastroenterologists and GI nurses who want an initial PEG system that is convenient to use and will help improve patient care. This program will provide an overview of the EnTake PEG system. First, we will show you the convenient layout and organization of the kit components. Dr. Chris Thompson at Brigham and Women's Hospital in Boston will then demonstrate a PEG procedure using the EnTake feeding device. The EnTake PEG safety system is indicated for percutaneous placement of a long-term initial placement feeding and/or decompression device, and was designed to reduce the risk of stoma site complications and infections. The system is a soft silicone gastrostomy tube and retention dome with dilating tip, packaged sterile in a kit containing sharps protected procedural aids. The kit components are procedurally organized from left to right in 2 trays for clinician convenience. The top tray contains all tools required for patient prep and access, including a fenestrated drape, surgical skin marker, a triple pack of ChloraPrep topical antiseptic swab sticks, lidocaine in a dedicated compartment and packaged in an individual sterile pack, 5 cc syringe, injection needle, scalpel, introducer needle, a disposable grasping snare, and 5 4x4-inch gauze pads. The top tray will also include a blue cable hoop if ordering the pull-only kit for tube placement, or a guide wire if ordering the push-only kit for tube placement. The bottom tray includes all you will need for PEG placement: a PEG tube, 5 4x4 gauze pads, lubricating jelly, disposable scissors and hemostat, tubing clamp, 2-part feeding adapter, 2x2-inch fenestrated gauze pads, Lotifor PVP ointment, and a linear and star bolster. You will notice that the EnTake star bolster is designed with 37% less surface area and developed with 75% larger windows than standard designs. The PEG tube French size is molded into the upper surface of the star bolster, and 5 round pads with a generous radius evenly distribute pressure away from the stoma site for added patient comfort.
Inspect the contents of the kit and packaging for damage. If damaged, do not use. Prepare the patient as required for upper endoscopy. Introduce the endoscope and perform clinically approved EGD exam. Insufflate the stomach. Transilluminate the abdominal wall to select the site of PEG tube placement. Apply finger pressure at the clearest transillumination point. A clear indentation of the gastric wall should be visible on the anterior surface. Note, selected site should be free of major blood vessels, viscera, and scar tissue. Demarcate the desired incision site with a surgical skin marker, or follow a local standard operating procedure. Prepare the proposed site with ChloraPrep swabs, or follow a local standard operating procedure. Administer lidocaine to the proposed puncture site. Twist open the plastic lidocaine ampule. Attach the syringe to the luer lock neck and hold the lidocaine upside down. Withdraw the desired amount and unscrew the syringe from the ampule. Attach the safety needle to the syringe and infiltrate local anesthetic subcutaneously into the skin at the proposed puncture site. After injection, activate the needle shield away from yourself and any other person by pulling down on the outside tabs of the syringe barrel and dispose of. Activate the safety scalpel by pressing forward on the raised section of the scalpel until you hear a click and the blade is locked out. Make a minimum 1 centimeter skin incision at the selected site. Discard the scalpel in an approved puncture-resistant waste container. Gently separate the skin and subcutaneous tissue with your fingers. Remove the 18-gauge introducer safety needle. Be careful not to press the safety button located on the side of the introducer, as this will lock the needle in. Remove the needle protector and advance the safety introducer needle through the skin incision and into the stomach under endoscopic vision. Once in position, retract the needle into the safety shield by firmly pressing the safety button located on the needle hub. Close the grasping snare around the introducer safety needle. At this point in the procedure, the clinician may employ one of two methods for placing the tube: the pull method or the push method. This will depend upon your hospital or department protocol for placement. Remove the guide wire retaining plug from the hoop. Pull the flexible end of the guide wire from the retaining hoop and pass through the cannula into the stomach. It is recommended that approximately 24 inches of guide wire be withdrawn from the hoop prior to insertion. Close the grasping snare around the introducer safety needle. Loosen the grasping snare. It should surround only the guide wire approximately 2 to 3 centimeters from its distal tip. Then retighten it. Withdraw the gastroscope, grasping snare, and guide wire simultaneously from the patient's mouth. The guide wire now exits the body from the patient's abdomen and mouth. Slide the gastrostomy tube assembly, dilator end first, over the end of the guide wire exiting the patient's mouth. Apply a water-soluble lubricant to the gastrostomy feeding tube assembly. Note: straighten out the dilator portion of the device prior to sliding it over the guide wire. Maintain firm tension on both ends of the guide wire as the gastrostomy tube assembly passes through the oropharynx and into the stomach. As the firm, tapered end of the gastrostomy tube is pushed through the anterior abdominal wall, it will also push the cannula out. Note: if excessive resistance is met while exiting the abdominal wall, a hemostat may be used to enlarge the opening and reduce resistance. When the soft silicone portion of the gastrostomy tube is passed through the abdominal wall, remove the guide wire by pulling it through the patient's mouth. Reinsert the gastroscope to follow the tube as it enters the stomach, and the dome just meets the gastric mucosa to ensure safe passage of the internal bumper. There should be no blanching of either the gastric mucosa or skin. The scope should remain inserted until the procedure is complete to confirm correct placement. Cut the gastrostomy tube approximately 12 inches or 30 centimeters from the skin level using the enclosed scissors. Cleanse the gastrostomy tube and wound site. Advance the external bolster over the feeding tube until it is close to, but not snug against the skin, using the enclosed hemostat. Place the pinch clamp on the tube and attach the dual port feeding adapter. The gastrostomy is now complete. The internal dome of the gastrostomy tube must be removed via traction method. Failure to remove the dome by one of these methods may result in small bowel obstruction and/or perforation. Lubricate the stoma. Slowly rotate the gastrostomy tube and gently push it 1 to 2 centimeters into the stomach to disengage from the fibrinous tract. Grasp the gastrostomy tube close to the stoma site. Wrap the gastrostomy tube firmly around the hand if desired. Apply firm counterpressure to the abdomen with the other hand. Pull the gastrostomy tube using steady tension, repositioning the hand, keeping it close to the stoma. As tension is being applied to the gastrostomy tube, the internal dome will fold and then emerge through the abdominal wall.
This concludes the in-service for the EnTake enteral feeding device. If you have additional questions or require more information, please contact your local sales representative or call customer service at 1-800-448-6506. You can also visit our website at www.conmed.com. ConMed Endoscopic Technologies specializes in gastroenterology and offers a full line of products along with the PEG system, replacement G-tubes, J-tubes, and accessories. With a line of minimally invasive diagnostic and therapeutic specialty products for the diagnosis and treatment of gastrointestinal disorders, ConMed Endoscopic Technologies is a recognized technological leader in the GI market. We apply ingenuity to deliver meaningful innovation for real clinical solutions.